The vast majority of our daily cases continue to be migrant workers residing in the dormitories. As we systematically clear the workers and the dormitories, we expect the number to remain high over the coming weeks before gradually declining as we complete the clearance. My co-chair, Minister Lawrence Wong, will provide more details on our progress in clearing the dormitories shortly. Let me just talk about the community cases. Since the lifting of the circuit breaker some 1.5 months ago, the number of community cases has increased but continued to remain low, at about an average of 12 per day. In the past week, this is similar to the number in the first week of July. It will be useful for us to take a closer look at these community cases to better understand the underlying trends. Firstly, around half of the community cases over the last 2 weeks are linked, and most were detected as a result of contact tracing or proactive screening. We are always more concerned about the unlinked cases. About 7 in 10 of the unlinked cases were asymptomatic, and almost half are likely to be past infections as they are tested positive when we ran serology tests on them. They would probably not have been detected if not for our proactive screening approach, as they are asymptomatic. This means that they are unlikely to see a doctor because they are generally well, and they would not have been picked up otherwise. Therefore, the number of cases we see is actually somewhat dependent on our screening approach. Furthermore, amongst these unlinked community cases, we continue to see a large proportion linked to the construction and related sectors. They are classified as unlinked because we cannot identify the specific individual or cluster that passed the infection to them, but they appear to be linked broadly to the construction and related sectors. As I shared last week, we are keeping an especially close watch on the symptomatic unlinked cases that are detected in the community through our routine screening for acute respiratory infections, or ARIs. If these cases start rising, it could be an early signal to us that there may be an increase in the underlying transmission in the community. To detect these cases early, from 1st July, we have been testing all individuals aged 13 and above who are diagnosed with ARI symptoms at first presentation to a doctor. This allows us to detect infected individuals early and to quickly contain them and prevent further spread. We are now testing on average about 2,400 ARI cases a day. Even with this rigorous testing, the number of unlinked COVID-19 cases detected through this ARI screening in the community has remained stable and continues to be in the low single digits. This suggests that the prevalence in the community remains low. But this is not the time to celebrate and be complacent. We are certainly not out of the woods yet. Globally, there are now more than 13 million people reported COVID-19 cases and more than 500,000 deaths associated with COVID-19. Many countries, such as the United States and Brazil, are still reporting surges in case numbers with no signs of slowing down yet. The World Health Organization has recently warned that the situation would get worse unless there is collective effort to control the transmission of the virus. While some countries, including China and New Zealand, have largely managed to bring the outbreak under control, several others are experiencing a resurgence of cases a few weeks after lifting their strict social distancing measures. Some regions have had to reintroduce restrictions in an attempt to bring the transmission under control. Let me show you a chart just quickly. We must be prepared for a second wave too, but we must do our best to avoid it if we can. There are useful lessons we can glean from their experience to avoid a similar scenario in Singapore. The Ministry of Health has reviewed these case studies and found that in many countries or regions where there had been a resurgence of cases, it was because safe management and safe distancing measures had not been adhered to. As you can see from the chart, many countries are seeing a second wave confronting them. From these cases, we have found that some had gone out when they are unwell and mingled in settings where many people had congregated. These include religious events, parties, and large family gatherings. In South Korea, for example, door-to-door sales resulted in 4 clusters with over 200 infected cases. And religious gatherings there resulted in more than 110 confirmed cases recently. In Tokyo, Japan, more than 300 cases have been linked to nightlife establishments. In Victoria, Australia, large school clusters have been spawned as students did not practice social distancing and participated in non-school related social gatherings outside. In Hong Kong, there have been outbreaks at restaurants and cafes as patrons did not put on their masks after they have completed their meals. In many regions, lapses in workplace safe management measures, including workers not wearing masks, have resulted in large clusters too. I know many Singaporeans and organizations are keen for more flexibility and further relaxation. But from these examples, we know there are settings and activities that are more susceptible to transmission, where there is close and prolonged contact among individuals. These include workplaces, religious gatherings, as well as nightlife establishments. That is why in Singapore, we have taken a cautious approach in easing restrictions for some activities that we know to be of higher risk. For others that need to continue to function, like workplaces, we have put in place a series of measures to reduce the risk of spread at these settings. Some of these measures create inconvenience, but it is better to be safe. Still, with the significant expansion of economic activities and social interactions since phase 2 started, we should expect to see the number of cases rise. What is important is to detect these cases early and ring-fence them to prevent further transmissions and the formation of large clusters. The second wave is preventable if everyone plays our part. And I believe that if anyone can do it, Singaporeans can.